This is giving cardiogenic shock. Do you work in a unit that doesn't utilize swan catheters a lot? Listen to this story time and see if it can help you take care of patients who may be in cardiogenic shock even without hemodynamic monitoring in the future. My name is Leah. I've been a CVICU nurse for 18 years, and I'm a big nerd and love talking about hemodynamics and all things CVICU related. So I was taking care of a patient that came in for a regular STEMI. STEMI, got his stent, came to the floor. So everything's going super smooth, except that after this guy got his stent, he gets off his little bed rest, and then they cannot get him off Levophed, which is norepinephrine to keep his blood pressure up. And in most of our stents, that's not something that's super common. We don't normally have our patients on norepinephrine after they've come back from their stents. It's not a normal find. Do you have low blood pressure normally? And he's like, no, I actually have high blood pressure all the time. The next night I come back and I go into his room to talk to him. He's still on norepinephrine. And I'm like, that's not right. This isn't, something's wrong. So I go and I chat with him. Tell me how you feel. And he was like, well, I feel short of breath. And I didn't feel that way whenever I came into the hospital. I feel cool. I just feel like sluggish in my brain. Like I don't feel like I'm normal, and I can't lay down whenever I do. I feel as if like I can't breathe. And I'm like, this is the symptoms of hemodynamic compromise. Like this patient is not okay. He looks just fine. He's sitting in a recliner. He's chatting me up. His blood pressure being on a touch of Levophed, we couldn't wean him off. He was like on 0.04 is, he has a map of like 68, 69. But other than that, heart rate's fine. I checked his pulses. They were okay. I listened to his lungs. It's not terrible. But all my spidey senses were saying, this isn't right. Talk to our providers, kind of let them know my feelings about it. They were like, yeah, an echo's been done today, waiting on those results. And about midnight that night, this guy who's sitting in a recliner literally goes into VTAC and codes, and we have to do chest compressions and defibrillate him. We luckily were able to get him back. We're lucky to have an intensivist advocate to the cardiologist, like, you need to take him back to cath lab and look around and see if there's something that is missed, or see if something has changed, or see if he needs an Impella. Something is not correct. And sure enough, that patient went to cath lab and ended up with an Impella. You can know a lot about what's going on with the patient hemodynamically without hemodynamic monitoring. If you like talking about hemodynamics and learning things as I'm learning along with you guys, follow this account, like this video, and comment below. Have you seen a patient that you were pretty sure was in hemodynamic compromise, even though they looked pretty good? And what did they look like? And what were the symptoms that you saw that made you know, even without invasive monitoring, that something wasn't quite right?